Today I am Celine de la Cruz, a first-year Bachelor of Science in Nursing student of Notre Dame of Kidapawan. So I am going to do the perineal care procedure. So first, what is perineal care? It is the washing of genital and anal area with plain water of medicated solutions. So its purpose is first, to cleanse the secretion and excretion, to reduce unpleasant odors, to prevent skin illnesses, and to promote comfort. So, the equipments to be used during the perineal care procedure is first we have here a bedpan. We also need a lukewarm water for flushing of the perineal area. Next would be your bath blanket, your adult diaper for patient supply, a kidney basin which will serve as your waste receptacle, a piece of paper to wrap the vaginal pads, a sterile kidney basin for your container to the sterile cotton balls, your cotton balls soaked with antiseptic solution and with soap solution, your working gloves and a tissue paper, and lastly, your forceps, but I have here a tongs. Entering the room, you must first assess the client's general appearance and consciousness. So, good morning, ma'am. I am Celine, your nurse for today. So, what is your name, ma'am? Your age? Your birth date? So, what do you want me to call you? Okay, Bea. So, Bea, we're going to do the perineal care. It is the cleansing and washing of the genital and anal area to prevent infections and illnesses. So, after the procedure, I will document all the result and the result will be kept confidentially. So, I might touch. Is that okay with you? Okay, thank you. So, if the clients agree, then proceed to the procedure. Before doing the procedures, you must first wash your hands to deter the spread of microorganisms. You must put all the equipments on the bedsides to have organization and time management, which is the equipments are there already in the bedside, and you must close the doors to have a client's privacy. We need to wash as the bed to appropriate working height, ensuring a proper body mechanics. So, we will put this bath blanket in the abdomen of the patient. We will roll up this linen in order to not be soiled during the procedure. Remember to expose only the external area of the patient. Now we put already the bath blanket in the proper position. Now we do the dorsal position. So you must do the dorsal position to the patient. So, the knees are flexed, the legs are separated, only the external area will be exposed, and this is the dorsal position. So, next step, I will wear my working gloves and put a bedpan under the patient's buttocks. Put your working gloves. You must know the size of your working gloves in order to work well during the procedure. So, you must place this bedpan under the patient's buttocks. You must place this bedpan under the client's buttocks. So, ma'am, can you please lift over? Okay. This bedpan will collect the water during perineal cleansing. So, thank you, ma'am. Next step is to flush the perineal area with a lukewarm water. So, before we flush the perineal area with a lukewarm water, we need to check the temperature of the water to avoid burns. So, we can use a wrist. So, the water is in the good temperature. We can now flush it to the perineal area. Before you perform with cotton balls, you need to place this waste receptacle under the bedpan. So, this is our sterile kidney basin. We should open this one, bearing in mind that it should not be contaminated. So, we should not touch the inside surface. So, we must put our soap and antiseptic cotton balls with a use of forceps. So, I must first put the cotton balls with antiseptic in the kidney basin. Then, the cotton balls with soap solution. So, I'm done with putting the cotton balls with antiseptic and soap solution in the kidney basin. Now that we have already prepared our cotton balls, we will start the external procedure. Using a pick of forceps, we will use the cotton balls with a soap solution in cleansing your perineal care. So first, cotton ball should be in zigzag motion in your mons vanitas upwards to your lower abdomen. And then you drop your waist on the waist receptacle. True cleansing and care should be taken to avoid introducing secretions and bacteria into the opening through which urine is released. The second cotton ball should be in the farther leg from the inner crease of the groin, zigzag motion to your farther legs towards your knees. Then, waist to the waist receptacle. The third cotton ball is used to wash the inner aspect of the near thigh using the similar strokes, which is the zigzag motion. Okay. The fourth cotton ball is used to wash the farther labia majora in a downward stroke towards the groin. So you can use your two thumbs, then one stroke, then put it in the waist receptacle. So the fifth cotton ball should be used in the near labia and do to the other labia. One stroke, then put it in the waist receptacle. The sixth cotton ball should be used to wash from the clitoris down to your meatus, vaginal opening, to your perineum. Then put it in the waist receptacle. And the seventh ball is used to cleanse from your clitoris down to your anus. Then put it in the waste receptacle. After cleansing the external area with the cotton balls, next, rinse with sterile water and dry using toilet paper from front and back. Moisture supports the growth of microorganisms and contributes discomfort. Okay. So, we need to dry it up. So, pat dry from top to bottom. Okay. Remove the client from the bed pad. Turn side and dry the anal area using toilet paper. So, I must put it on the side, this waste receptacle. Okay, ma'am, can you please lift over? Okay, I will help you. Okay. Then put this bed pad on the side. So we must put this diaper or a pad to the patient. After that, remove this bath blanket. Put the top sheet back. Make sure that your clients feel comfortable. Okay, it's done, ma'am. After putting the top sheet, you must take off your gloves, bring back the equipments into the utility room, wash your hands to prevent microorganisms, and document all the results. So that's the procedure of doing the perineal care procedure. Thank you.